Hello friends, welcome back to my YouTube channel, that is ENT Chronicle, and topic of discussion for today is non-allergic rhinitis. Okay, so there are various type of non-allergic rhinitis, as you guys could see in this particular slide. These non-allergic rhinitis include something known as the vasomotor rhinitis, drug-induced rhinitis, rhinitis of pregnancy, honeymoon rhinitis, rhinitis due to hypothyroidism, non-airflow rhinitis, gustatory rhinitis, rhinitis medicamentosa, and finally we have the emotional rhinitis. So there are various type of non-allergic rhinitis, but we will limit our discussion to only two, that is vasomotor rhinitis and rhinitis medicamentosa. So without any further ado, let's start with vasomotor rhinitis. So according to the definition, vasomotor rhinitis is non-infectious, non-allergic and non-structural. All right, nothing infectious, nothing allergic, nothing structural becomes the cause of vasomotor rhinitis. All right, but it is a clinically stimulating nasal condition with symptoms of nasal obstruction, rhinorrhea and sneezing. All right, so the full definition becomes it's a non-infectious, non-allergic, non-structural but clinically stimulating nasal condition with symptoms of nasal obstruction, rhinorrhea and sneezing. And one of these symptoms may exaggerate more than the other. For example, rhinorrhea may be excessive in case of vasomotor rhinitis. So since it is non-infection, there is no infectious pathology, it is non-allergic as well as non-structural. So what becomes the cause of vasomotor rhinitis? So the major cause of vasomotor rhinitis is autonomic imbalance. Autonomic imbalance. Now we will discuss about the pathogenesis of vasomotor rhinitis. Okay, let's start. So one thing to remember is nasal mucosa has a very rich blood supply. It is said that vasculature of nasal mucosa is almost similar to erectile tissue. That is, blood is collected inside these venous sinusoids. All right, blood is connected in these venous sinusoids. These venous sinusoids are also referred to as lakes of blood in the nasal mucosa. And the size of these venous sinusoids are controlled by externally placed smooth muscles fiber. So if this smooth muscle contract, they would lead to the constriction of or compression of these sinusoids, and if these smooth muscle relax, this will leads to engorgement of these venous sinusoid, leading to filling up of even more blood. All right, so this is the physiology of nasal mucosa. Now if in the body there is sympathetic stimulation, it will lead to vasoconstriction and shrinkage of mucosa because the smooth muscle will contract. This will lead to compression of the venous sinusoids, that is, less blood will be collected within the sinusoids. And if there is parasympathetic stimulation in the body, it will lead to vasodilation and engorgement of venous sinusoids. As you guys could see how much blood is filled up due to parasympathetic stimulation. This is referred to as the engorgement of sinusoids. Thus, sympathetic stimulation compresses the sinusoids, less blood, whereas parasympathetic stimulation leads to engorgement of sinusoid, that is, collection of more and more blood in the venous sinusoids of nasal mucosa. Now, the problem in vasomotor rhinitis occurs is that there is overactivity of parasympathetic system, which means there is going to be excessive engorgement of sinusoid, and this excessive engorgement of sinusoid will lead to excessive filling of these venous sinusoids, that is, the lakes and lakes of blood. All right, so therefore there is going to be increased secretion from nasal glands, and which becomes the cause of rhinorrhea. All right, which becomes the cause of rhinorrhea. Now this overactivity of parasympathetic more than the sympathetic one is referred to as the unstable autonomic system or autonomic imbalance, which becomes the cause of vasomotor rhinitis. And What are the factors that leads to this instability in the autonomic system? We have something known as the precipitating factor, which leads to precipitation of unstable autonomic system. First, we have rapid change in climate. Then we have irritants like fume, and if the person smokes, we have stress as well. So let's devise the pathogenesis once again. We know nasal mucosa has a very rich blood supply, almost similar to like erectile tissue, and it is divided into various venous sinusoids or lakes of blood, controlled by action of autonomic system via the help of smooth muscles. When sympathetic system acts, it leads to vasoconstriction and shrinkage of mucosa, that is decreased blood filling. And if parasympathetic stimulation happens, it leads to vasodilation and engorgement of these venous sinusoids, that is filling up of more and more blood. And due to precipitating factors like change in climate, irritants, stress, and fumes, it leads to instability in the autonomic system, leading to its overactivity. Now, this overactivity of parasympathetic system leads to increased secretion of nasal glands, leading to rhinorrhea. And this increased secretion from nasal glands is vasomotor rhinitis. All right, it was very simple. Now, another thing to remember is parasympathetic supply to nose is brought about by which nerve? That is Vidian nerve. So Vidian nerve is the nerve which brings about the secretomotor fibers of the nasal mucosa. You have to remember this fact. Remember, Vidian nerve is parasympathetic supply to the nasal mucosa. Alright, let's move ahead to the signs, symptoms and complications of vasomotor rhinitis. Symptoms include, we have something known as the paroxysmal sneezing. That is, there are bouts and bouts of attacks of sneezing. The patient doesn't stop sneezing, and typically this paroxysmal sneezing starts as soon as the patient wakes up early in the morning. Then we have rhinorrhea, excessive rhinorrhea, I must say. The patient wets many napkins in order to wipe his nose. So there is paroxysmal sneezing, there is rhinorrhea, of course there is going to be nasal obstruction, and finally we have throat discomfort as symptoms. But two main symptoms are paroxysmal sneezing and excessive rhinorrhea. For signs include nasal mucosa is congested in vasomotor rhinitis, and this congestion is due to excessive engorgement of venous sinusoids. Alright, there is also hypertrophy in the turbinates. So there is hypertrophy of turbinates, and because of this hypertrophy we see the nasal obstruction. Alright, so what are the complications? So long standing cases of vasomotor rhinitis leads to development of the following things, that is development of nasal polyps, development of hypertrophic rhinitis, and finally there is inflammation of sinuses as well. Alright, now let's see the treatment of vasomotor rhinitis. So we have both medical as well as surgical treatment procedures, but initially we start the patient with medical intervention and not the surgical intervention. If the patient is not following or recovering from medical intervention, we give the patient surgical one. Alright, in medical management, we ask the patient to avoid any kind of precipitating factor. For example, rapid change in climate, alright, any stress, fumes, staying away from smoke, and stop smoking. Alright, so first important one is avoidance of precipitating factors. Then we give patient antihistaminics and oral nasal decongestants for his symptoms. Topical steroids to the patient as spray or aerosol, alright, to reduce inflammation. Then for short term course we give systemic steroids. Alright, so medical management include avoidance of precipitating factor, antihistaminics and oral nasal decongestants, topical steroids, and short course of systemic steroids. Alright, if the medical management is not working, we move towards the surgical management. So two major symptoms in surgical management include nasal obstruction due to increase in size of turbinates, and finally we have excessive rhinorrhea. So to reduce nasal obstruction, we tend to reduce the size of turbinates. And how do we achieve this? We achieve this by partial or total turbinectomy. That is, we reduce the size of turbinates with the help of turbinectomy. Alright, for the patients of excessive rhinorrhea, rhinorrhea is not stopping even after taking medicines to control it. We do something known as Vidian neurectomy. Vidian means parasympathetic supply to the nasal mucosa, Vidian nerve, and neurectomy means cutting of the nerve. So we already know that the parasympathetic supply is coming from the Vidian nerve and it is the main culprit in vasomotor rhinitis. So if the patient is not getting corrected or getting relief by taking so many drugs, we simply cut the Vidian nerve transnasally. It is referred to as Vidian neurectomy. It is important to know where is Vidian neurectomy done. It is done in vasomotor rhinitis. So this was all about vasomotor rhinitis. Now let's move towards the second one, that is the rhinitis medicamentosa. So rhinitis medicamentosa occurs due to prolonged use of nasal decongestion drops. Alright, in the name as well, it is referring something to medicine. Therefore, if the patient takes long duration nasal decongestion drop, the following things happen. What happen is there is initial vasoconstriction because of decongestion drops, and when this vasoconstriction happens for a quite a long time, it leads to hypoxia and collection of toxic metabolites due to decreased perfusion, and this leads to reflex vasodilation of the vasculature. Now this reflex vasodilation does three things. All right, first, it reduces the vasomotor tone. Second, it increases the parasympathetic activity, and third, it increases the vascular permeability. Because of increased parasympathetic activity, there is going to be congestion of the mucosa, alright, which is similar to that of vasomotor rhinitis. And after congestion of mucosa, there is excessive fibrosis, and now this fibrosis leads to increase in size of turbinates or hypertrophy of turbinates. So increase in parasympathetic activity, congestion of mucosa, and finally hypertrophy of turbinates. It is all similar to vasomotor rhinitis. The only difference between rhinitis medicamentosa and vasomotor rhinitis is its causation. Rhinitis medicamentosa occurs due to prolonged use of nasal decongestion drops, whereas vasomotor rhinitis occur due to autonomic imbalance. Signs and symptoms are all similar to vasomotor rhinitis. Just remember the ones I have written in the vasomotor rhinitis. Treatment is, since it is caused due to prolonged use of nasal decongestion drops, we will simply ask the patient to withdraw the use of nasal drops from now on. And along with this, we ask the patient to start short course of systemic steroid therapy. If the patient complains of nasal obstruction, we may or may not do surgical reduction of turbinates. So these two things are to be done compulsorily, whereas surgical reduction of turbinates has to be done in accordance with the severity of nasal obstruction in the patient. Alright, so this was all about rhinitis medicamentosa and vasomotor rhinitis. If you like this video, please subscribe, like and share. Thank you.